Hi everyone, welcome back to Tobacco Talk Tuesdays. My name is Caitlin and I'm one of the tobacco treatment specialists here at Unified. And today I'm going to be talking to you about the tobacco industry, specifically talking to you a little bit about big tobacco, some of the history in regards to the commercial industry, where we're at, marketing strategies, and specific populations targeted by big tobacco, and then a little bit about the COVID-19 response that we've seen in the last few months. So just a note before I move on, we have previously discussed this a little bit in some other streams. Very briefly, I touched on it in our vaping and e-cigarette Q&A video, and far more in depth in Amber's Tobacco as a Social Justice Issue video. So definitely check out Amber's for sure, but check out both if you've got time here on Facebook or YouTube. And of course, as always, leave any questions, comments in the comments below, and I will get to them at any time throughout the stream, but definitely before I sign off for the day. And of course, always check out those comments below for additional links and resources that I posted that really informed the stream and will give you a little more to look at in regards to the information. So we'll get started with who is big tobacco. If you've been on one of our live streams before, or if you've spoken with anyone from our tobacco team or come to a group or anything like that, you might have heard us reference big tobacco. And so basically when we talk about big tobacco, we're talking about the largest tobacco companies globally, but also just in the United States as well. So if we're looking on a global scale, the top 5 companies that sell tobacco products would be Philip Morris International, which owns brands like Marlboro, and IQOS, which is an e-cigarette product. Altria, which actually owns the American portion of Philip Morris International, which has stakes in Juul, but also owns brands like Black & Mild, Copenhagen, and Marlboro. British American Tobacco, which has brands like Lucky Strike, Pall Mall, and Kool outside of the US specifically. Imperial Brands, which owns Kool and also has Blue, which is an e-cigarette and vaping product. And then Japan Tobacco International, which owns the Camel brand outside of the United States. So basically, we're just looking at the major players in the tobacco industry. If we look specifically in the US again, we might want to mention RJ Reynolds or Reynolds American, which owns the brand Newport, but looking at both the international and domestic scales there. And so tobacco is actually a multi-billion-dollar industry. It brought in is worth, I think, about $47.2 billion in the United States. And they also spend billions of dollars on their marketing, with about $9 billion spent in 2018 on marketing alone. And specifically, they're very good at a targeted marketing. So targeting specific populations and groups in order to increase their profits. So if we look a little bit about the history of the commercial tobacco industry in the United States, back in 1760, Pierre Lorillard, don't think I said that right, founded the first company that processed tobacco to make cigars and snuff. And they're currently owned by RJ Reynolds, the Reynolds American Corporation. And this was actually a little over 100 years after Massachusetts implemented a state law against public smoking. And even though we think research about the harmful impacts of tobacco is more of a modern thing, it actually goes back as far as the 1600s and 1700s. And it's not actually till the 1900s that we see cigarettes being made and sold as a major tobacco product within the United States, with about 3.5 billion sold in 1901. Fast forward a little further, in 1964, the Surgeon General released a report advising of the serious negative health impacts of regular tobacco use. And in 1985, lung cancer actually became the #1 cause of death in women. I do want to make a note that tobacco has been used for hundreds of thousand years, for cultural reasons, for religious reasons, for medicinal purposes. And there's a huge difference in tobacco products then versus tobacco products now, and that current commercial tobacco products have a lot more harmful ingredients, and cigarettes in particular are designed specifically to get people addicted to them. So there's just some differences there. And like I said, tobacco is a multi-billion-dollar industry, and they're an industry that puts a lot into their marketing and advertising and does it pretty successfully if you look at it from a business standpoint. In 2018, they did spend about $9 billion on advertising and promotion in the United States alone, which is about $25 million a day. It's just spent on advertising. About 8.4 billion, of that was spent on cigarette advertising and promotion, and about 650.5 million was spent on smokeless tobacco advertising. And about 92% of that 8.4 billion was actually spent on discounts and also promotional allowances to wholesalers and retailers in order to reduce the price for cigarette consumers and sell more product. So we all know commercialized tobacco products harmful to the health. We know this, we're well aware of this, and the industry also knows that. And despite that, they continue to sell and promote a product that is specifically designed to get someone hooked on it and cause severe negative health outcomes, basically, for anyone and everyone who uses it. And like I said, the industry is really well aware of this, and despite that, they continue to profit off it and continue to target specific and new populations. And on top of that, they have a real history of working to deny and confuse any kind of scientific evidence that we have that these products are harmful. So let's talk about specific populations. So we've discussed too in previous live streams the Black community and youth and young adults, but they also have a history of targeting the LGBTQ community, people who are living with mental illness, Native Americans and Asian Americans, and women. And this has been done through their names, their branding, sponsoring of community and cultural events, representation in media and advertising, working to boost ads in specific communities and locations, infiltrating mental health institutions, and specific campaigns, giveaways, and donations and financial support. So I'm hopefully going to share my screen with you guys. So hopefully this works and you can see that. If you can't, I'm sorry. So if we're looking specifically at the Black community, mental marketing has been really big in that they're known to be more popular with Black people. They're advertised as easier to smoke, which they are, but they're not advertised as harder to quit, which they also are. And specifically, we've seen a lot of targeting towards Black youth, not just the community in general, in that it's been shown that retailers are more likely to sell to youth in predominantly Black neighborhoods. And similarly, in these neighborhoods, there's an increased amount of tobacco retailers near the schools and also increased marketing when compared with other neighborhoods. They've also done things like event sponsorship, branding and specific ads, like you can see the cool one on your screen, and this one from IQOS. And since the 1950s, the tobacco industry has really worked hard to develop and maintain relationships and partnerships with Black organizations to make a profit. It's specifically to make a profit while trying to align themselves as the ally and the friend. And this has all kind of resulted in the fact that even though Black people actually smoke at lower rates when compared with national averages, they suffer disproportionately when it comes to smoking-related chronic and preventable diseases. Gotta skip a couple here. All right. The next one I want to talk to you guys about is the LGBTQ community. Specifically, if you haven't heard of Project SCUM, it stands for Project Subculture Urban Marketing, which was a scheme developed by the industry to target LGBTQ people within San Francisco. They've also done sponsorship of Pride events and Pride-themed ads like the ones on your screen, or at least hopefully on your screen. They've donated money to HIV and LGBT organizations. Specifically, Philip Morris International has done this. And the result is that LGBTQ people actually smoke at 2.5 times the rate comparatively, and they also have higher use rates for all other forms of tobacco as well, not just cigarettes. So I don't have an ad for the next one I'm going to talk about, which is people who are living with mental health issues. So about 1/3 of people with mental illness also smoke, and they smoke at heavier rates actually. So there's kind of a different tactic when it comes to this population from the industry. Not so much on the ads or anything like that, but if you look back into the 1980s and 90s, it's actually shown that the tobacco industry targeted psychiatric hospitals with sales promotions and giveaways. So infiltrating these hospitals and getting the patients their cigarettes. They've also done things like donations. They've fought against no smoking policies in medical facilities, and again, specifically within the psychiatric hospitals. And the big one here is that they actually funded research to try and show, and funded biased research, I should say, that it's actually less harmful for people with schizophrenia to smoke, which is not the case as far as I'm aware. And also they've tried to produce funded and biased research showing that their products are necessary for self-medication. And this last one's really big because there's this huge misconception that smoking can relieve things like anxiety or depression or stress even, when really it's just causing worse effects. So, if someone smokes when they're feeling anxious, they think it calms them down because they've gotten that hit of dopamine, when in reality, it's just kind of masking the problem, and it's actually going to worsen the problem later on when the effects wear off. And it's just going to continue in a really vicious cycle that's helpful to absolutely no one. So this is a huge issue. And as I move into my last couple groups here, I want to talk to you guys about, I'll bring this back to your screen. The tobacco industry has also targeted women, Native Americans, Asian Americans, and youth and young adults. They've done this through names like Slims, as you can see from the ad on your screen, American Spirit, Rio Dorado, all of that. They've done sponsorship of events like Chinese and Vietnamese New Year festivals. They've done advertising, again, in densely populated areas, and financial contributions to organizations within these communities. Branding and ads, as I said, was a big one. And you can see that as we move into the e-cigarette and vaping market as well, with companies like Juul. And so youth and young adults is a big one here. And not only do they target youth and young adults specifically, but like I said earlier in the stream, they target youth and young adults that also make up other specific populations, such as Black youth. And they do this through flavors, social media, vaping, and e-cigarette products. And the big deal here is that when someone's under the age of 25, it's easier for them to get addicted to a nicotine product. And so for the tobacco industry, they're not just seeing someone who's young and has their whole life ahead of them. They're seeing someone who's young, has their whole life ahead of them, and is potentially now a lifetime consumer, because it's going to be harder for them to potentially quit later on in life. And so this is a huge issue. So let's talk about the COVID-19 response. So a lot of what I've seen in my work, and also personally when I'm just on social media in general, is there's been a real lean into the heated tobacco products, the vape pens, and the e-cigarettes. This is done a lot on social media. Specifically, Philip Morris International and British American Tobacco have been promoting heated cigarettes, e-cigarette products with stay-at-home messaging in the trends, all of that on social media. Philip Morris International has also been waiving, or at least did for a time, waive their ID validation, promoting this as contactless delivery rather than just really an opportunity to not have to check to make sure they're selling to adults and not youth. And e-cigarettes and vape brands and shops have also been doing pandemic-themed promotions, such as discounts or giving away masks when you order a certain amount of product. So really, it's been the same old, nothing really has changed as we kind of transition into the heated products, the vape pens, the e-cigarettes. They're still using non-peer-reviewed research or biased research in order to support their ideas. There are unproven health claims by e-cigarette companies, such as that nicotine might be a protective factor against COVID-19, which has not been shown anywhere as far as I know. And they've also been investing in vaccine research. And this is the big one, because this is kind of what the tobacco industry does, is they try to make themselves out to be part of the solution or on your side kind of thing. And we see this with across all different communities. It's not just now with COVID-19, in that they're saying, yes, we do make all this money on a really harmful product, and we're very rich, and we're going to take some of this and we're going to put it back in to do something good for the general public and public health, and see, now aren't we doing such a good thing by helping out? When in reality, they're just trying to hide behind this do-gooder narrative and avoid further criticism of their industry and of their products. So like I said, tobacco industry's super long history of targeting specific populations and communities that they deem easy targets in order to profit from their harmful products. This often involves the do-gooder or the I'm your friend narrative, and it's led to really long-term harm in many, if not all, of these communities, as well as enforcing misconceptions about smoking. I do want to remind anyone, if you've got any questions or comments, I don't think anyone's watching, so I don't think I'll have any questions or comments, but if you have comments and you're watching this later, feel free to add them at any time. Tobacco Talk Tuesdays will continue every second Tuesday of the month here on Facebook and YouTube at 2 p.m. And if you have any ideas for content you'd like to see, whether it be on Facebook, on the stream, on our blog, please reach out to our tobacco team, or if you just have questions about tobacco or our tobacco program, let us know. Amber and mine's numbers are there on the screen, and you can reach out to us at any time. And since no one's watching, I don't think I have any questions today, so I'll say see you next time.